In the shadows we find our light. Through the struggles we will take flight. Healing hearts and mending minds. Together we'll leave the past behind. Welcome to Persperity Podcast, where hope is found. Voices rising up, breaking new ground. With every story shared, we grow and learn. In this journey of healing, it's our turn. Mindful moments equal prosperous lives. Oh yeah. Mindful moments equal prosperous lives. Trauma whispers, but love will shout. In this space of trust, there's no doubt. We'll explore the depths of pain and grace, finding strength in every embrace. Welcome to Persperity Podcast, where hope is found. Voices rising up, breaking new ground. With every story shared, we grow and learn. In this journey of healing, it's our turn. Mindful moments equal prosperous lives. Mindful moments equal prosperous lives. Take a breath and join the ride. Together we'll walk side by side with open hearts and open minds. In this podcast space, true peace we'll find. Welcome to Persperity Podcast, where hope is found. Voices rising up, breaking new ground. With every story shared, we grow and learn. In this journey of healing, it's our turn. Mindful moments equal prosperous lives. Mindful moments equal prosperous lives. Persperity Podcast, a safe space for people healing from trauma. Persperity Podcast, a safe space for people healing from trauma. Persperity Podcast, a safe space for people healing from trauma. Hello, everybody. Give us a moment. We still sending out this link. In the meantime, if you're tuned in right now, can you please go like and subscribe, share this episode. We have a licensed doctor in the house tonight. So flood these comments. It's a blessed time tonight, you all. We about to have some fun.
Yes.
Yes. Okay. So, um, awesome. Okay. So, we get into my spew. Welcome back to Persperity Podcast. Today, we're having a crucial system challenging conversation, and the topic is beyond the physical, addressing mental wellness in primary care. This is about recognizing your mind is just as vital as your body, and that your doctor should treat them both. I am incredibly honored to welcome an expert leading to this charge, the insightful Dr. Rita Stanley. Get ready for powerful medical perspective that can change the way you view your health. Please remember to like, subscribe, and share this episode. It is essential. And I'd like to welcome Dr. Stanley. Thank you for being here. You want to shout out your business? I know you have a private practice or anything before we get into these questions.
No, here's my website, ritastanleymd.com to see it. Talk more about what I do.
Okay, let me drop that in the comments for the people. Okay.
I kept it simple, Destiny.
You said Dr. Rita.
Or just Rita Stanley, MD.com.
I think I did that. Wait, I think I spelled Stanley wrong. Okay. Rita Stanley, MD.com.
MD.com.
Gotcha. Neat. Awesome. Okay. Thank you.
You're so welcome.
Okay. So let's get into this first question.
Okay.
The first question is, your episode is titled Beyond the Physical. When you look at a patient in primary care, how do you initially look past their physical symptoms to see their underlying mental and emotional state?
Sure. And let me, if I can, Destiny, kind of lay out my path.
Yes,
Because I've been practicing now for almost 40 years. And I started out for 20 years, I was primary care. That's what I did. I had hundreds of primary care patients. And when they came in with a complaint I figured out what their complaint was coming from and I treated them. And that's what primary care is really. And that's how they train physicians now. They train physicians to make the diagnosis based on the symptoms and then treat with a medication for the most part. So I did that for 20 years. And then, I realized at the end of 20 years, people were coming in and they're saying, Dr. Stanley, I just don't feel good. Something's wrong. And so I would do my primary care labs again and say, look, everything's normal. I don't see anything. And what I wasn't saying, but I'm sure they heard me saying at some level is, yeah, it's all up here. But no, I was sincere. I knew there was something else going on. And, in that process, and I'm a Christian, and I can't help but just say that in that time frame from my transition from primary care to what is now called functional medicine, it was God leading the whole pathway and putting people before me. And before I knew it, I had transitioned from primary care to functional medicine. And that's where I learned that people aren't crazy. You are in your body. You are feeling what you're feeling. And there's always a reason for it. The question is, does the doctor even know what to look for? So I had to learn a whole nother level of when someone says this, what do I need to be looking for? And in functional medicine, we're not looking for just to fix a symptom. We're looking for the root. We want to get to the root of it. What's the underlying cause of what you're feeling? And, so when I finally transitioned to functional medicine, I really could help people because I wasn't just throwing stuff at them. I was digging deep and finding things that we could support. And many times it was not medicine. It was hormones. It was the right food. It was supplements. And so it is so life-changing for people. And I know we're going to talk more about the mental health piece of it. And I have a lot to say about that.
That's now look, you're flowing. Sometimes we monologue, sometimes it's dialogue, but I let guests flow any way they would like to.
Okay.
Anything necessary. Do not stop. You're okay.
And so, I know the focus really is around the mental health piece of it. And, what I want people to understand is, our bodies are so awesomely given by God, very interconnected. So we have a brain, we have a heart, we have lungs, we have kidneys. And in traditional medicine, and I don't mean to be critical, I thank God I came to where I am through traditional medicine. But what I know is, even though in traditional medicine, we treat people based on where they hurt or what's not working, we cannot, the worst thing we can do is to focus in on the heart and then not know what your hormone levels are, or not know whether you've got prediabetes, or not know whether you're inflamed. And so in functional medicine, we are really looking at your body as interconnected. And although you may come in with one symptom, I can't just focus in on that symptom. I've got to look at the whole, and I'll tell you what we look for in functional medicine. We look at the hormone system. And I do a lot of menopause. I do a lot of men's testosterone, but you got a number of other important hormones. So we look at your thyroid. How often do you get your thyroid checked in primary care? Not very often, maybe a TSH. So we look at your thyroid. We look at your adrenal gland hormones. And I know I single cortisol for 20 years, but in functional medicine, I know I have to check your cortisol level. And we hear about cortisol a lot because we demonize it as the stress hormone. And it is the stress hormone, but it's God-given, it's protective until our lives are so caught up in stressful situations in life that is too much of a good thing. So we do the thyroid, the adrenal hormones, your ovarian hormones, our testicular hormones. We look at your gut health, Destiny. Oh my goodness. I mean, most health begins and ends from gut problems. So we look at gut health. We make sure you're not systemically or total body inflamed. That's a measurement. We make sure you don't have diabetes, signs of diabetes years before you get the diagnosis. So I get excited about it because when you feel like something's wrong, let me tell you, something's not right. Yeah, something's off. So don't give up when you go to your doctor and say something's wrong. You may just have to find a different professional who knows how to do that. And that's just where we are now.
That's really good. That's
Yes.
good. So I do want to, for the people that may not know, they
Hmm.
see your name is hyphenated. Could you tell
Hmm.
them the hyphenation of your name, Rogers?
Sure, sure. Rogers is my maiden name, and again, I'm part of a legacy. My father was a physician. His father was a physician, and I think the greatest part, my great grandfather was actually an elder in the church. And we didn't really know and understand that growing up, but now I see with the direction that God has taken me, how, I mean, that's probably the greatest part of the legacy. But then God determined that he was going to take that, and the next two generations of men were physicians. And my dad was from Alabama. So he was from Alabama at a time. I don't even know how they did it. I really don't. And when I get ready to complain, I think, what am I complaining about? They were in deep South Alabama, Anniston, Alabama. And, I'm just grateful. And I didn't know to be anything but a doctor. I never, ever once heard my father say, I want you to be a doctor. I want you, never heard him say that. He just modeled it. And so that's what I became. And I know it's part of the legacy. It's part of what God purposed for my life. I always chuckle. I say, I don't know what I'm going to do. Nobody's going to be sick. But I know that the same thing that allows me to be a caring physician is going to carry on to eternity. But that's the legacy. So I'm always excited to share that with people. We all have a legacy, and sometimes we don't know all the details of it. But I thank God that's where I came from. Mhm.
Good. So
Yeah.
association, like you probably don't like to talk much about it, but Samuel Rogers in association with Kansas City would be your
Mhm.
father.
That's right. And he came here, you know, we take for things for granted. You go into a profession, you go here to get your training, and then you start doing it. But in those days, he went to medical school, but after medical school, he went to Howard in DC. After medical school, there weren't really any residency programs where you go to this place and get training in. So literally he and other colleagues had to do the work in order to even find a place where they could be trained in something other than just general medicine. So that happened in Kansas City at Old General Hospital. I mean, the history is just profound. At the Old General Hospital, where white doctors agreed to come in and train these black physicians to be, ultimately, my father was an OBGYN surgeon and some other specialty surgeons. So, Kansas City has a really rich legacy around the training of black specialists, especially. And so when Dr. Rogers got his certification to deliver babies and GYN surgery, he did that for a while. But then at some point in his life, and it's a God thing, it was part of the plan for his life. At some point in his life, he said, or God said to him, I don't know if he would acknowledge it like that, but basically his heart went out to help poor people who couldn't get, how are they going to get health care? And he watched his father in Alabama. And we remember this. My sister and I and brother, we would spend summers in Alabama, and we'd hear people knocking on the door at my grandparents' house, and there would be somebody on the front porch, either looking for help, looking for a doctor, looking for my grandfather in this case, or they were coming to pay him with eggs and food, and so we witnessed all that. So it make a long story short, when Dr. Rogers ended up in Kansas City, he ended up in Kansas City for a couple of reasons. He met my mother there, but also he couldn't get hospital privileges to go back when he wanted to go back and practice with his dad in Alabama. It was so segregated, he couldn't get hospital privileges. So his father said, just leave here, get as far away from here as you can. And that's how he ended up in Kansas City and met my mother. And then here we are. But yeah, it's a rich story. And so he ended up founding a community health center. They call them FQHCs, or federally qualified health centers around the country. And their whole objective is to provide quality, compassionate care to people who otherwise wouldn't get it. And I'm telling you, I would go to Rogers Health Center myself for my own self. You have to go there. You have to see it. And we just cut a ribbon on a new pediatric unit building, really, that's at the Samuel Rogers Health. It's going to serve over 4,000 children. So his legacy continues, and just the people who love his mission, some of them never have met him, but have continued to do the work to help people. And we need it now, because more and more children are going to be without food, with all the foolishness that we're facing. And they have it set up over there to get people what they need, not just for healthcare, but also food is health, and you cannot disconnect them. Yeah. So that's the short version.
True. Thank you for sharing that. So transitioning to another question. What was the pivotal moment in your medical training or career when you realized that mental wellness must be a primary concern in standard medicine practice?
And you're going to be surprised when you get this. Do you know, it's kind of been in two stages. Probably shortly after I started doing functional medicine about 16, 17 years ago, I realized that when people came in with what were probably more mental health symptoms than any other physical, I realized that you cannot separate the mental health from what's going on in the rest of the body. Everything's connected. So the first thing I learned was that I need to make sure that the very underlying core, like I talked about earlier, hormone health, gut health, inflammation, just some of those, I had to make sure systematically that those things were well. And if they weren't, I had to know what to do to make them well. So I saw a lot of people who came to me with what seemed like depression, anxiety, all those things that we call mental health, but are really reflections of systemic health or not. I realized that if I found anything that was out of balance on my testing and supported it, then the mental health got better. So in the beginning, I wasn't treating mental health. I was treating symptoms that included things that we would call mental health symptoms. But what they really were a reflection of other imbalances in the body. And once I was able to identify them and support them, then the mental health symptoms got better. So that was real early in my functional medicine side. But do you know, Destiny, and I'm gonna just say her name because I thank God for her. It's been in the last 6 months that I've really understood the impact of trauma, Destiny, of trauma on mental health. And again, you can't separate it. But trauma, which is, it is a brain, it truly is trauma, but it sets in motion a lot of things that then flow into functional medicine around, brain, adrenal health, and other hormone health. And so I was with a good friend, and she is a counselor, and she's a believer, a Black woman. Her name is Aliawa Unoke, and she has been practicing for about 12 years. And so we worked together here in Topeka for about 6 or 7 years. And then, I went my way, she went her way. And so we met up again about a few months ago just to have breakfast. And I was just talking to her because she's building her practice. I said, well, what's your specialty? She said, trauma. I mean, she didn't hesitate. She said, trauma. I'm like, what? Trauma? What do you mean by trauma? And she just started explaining, the things that have happened. And I believe there are very few people who've not had some level of trauma, but the trauma that can occur when you are a child, you have no control over it. You're getting traumatized by people who should love you or who you're in the home with. And I had no idea until she opened that door for me. And I started just seeing patients that I already knew in my practice, but I was kind of stuck. I mean, I had done everything I knew to do. with the functional, and they were still better, but there was this big but. They just couldn't get beyond something. And I realized my clients are traumatized, and I have not even allowed that part of their being or history to come forth. And so when she mentioned trauma, and she said, "Have you ever read the book, The Body Keeps the Score?" Everybody should read that.
I've been wanting that book. I think I asked Ms. Freeman for that book
My
just
God.
for Christmas.
The body keeps the score, and it means what it says. Our body, and that's how God created us. You cannot separate our brain health from the rest of interconnected systems. And it always makes me think of the triune God, God the Father, God the Son, God the Holy. You can't separate them. You know, we might want to and think we have more of one aspect of God than other, but no. So, once she opened the door for me to even consider that, it was like a domino effect. And so now, without fail, and I thought of those patients. I knew I had been missing it. And when I talked to them again, I just asked them, because we had a close enough relationship, I didn't have to warm up. They knew me, been with me for years. My average patient has been with me for 10, 12 years. And so when I would say, have you ever had a major trauma in your life? And I mean, either they broke down crying, or just like somebody had opened a floodgate, and some of the most horrible things I had ever heard came out of their mouth. And I thought, okay. And that's when, Destiny, I knew that even what I do, which is very important, is not enough. I have to reach out to my colleagues. I'm not going to be a trauma therapist. God's not saying that to me. But what I know I can do is work hand in hand with people who are doing that. And as we collaborate, I can say, okay, here's what's going on. We've covered the bases internally, and it just puts them in a better place to take the trauma therapy and really bring it to, because their body, I would have tuned up their bodies, but the whole work that it takes to open that up, and I don't know, that's not, and I'm not trying to be that. I want to be part of the team. And vice versa. If a therapist is seeing somebody they're treating for trauma, and they're the age of perimenopause or menopause or what, then let me, and that way together, they're eating right. I can make sure their hormone levels are good. I can make sure they don't have some other thing going on internally, while you're helping them to just face the awfulness of whatever traumatized them. So I see it so much as a partnership, and that's the part of my practice that I get excited about, because now I know, there is somebody that I can work with to really help people be free.
Go ahead. I just said, wow. Go ahead.
Here's the bottom line. And I say, God, why are you bringing this? I'm, to another 20 years into functional medicine. Why is this just now seemingly coming up? And what he keeps saying to me, because Dan, the times right now fully, we just trust God. It's like, why in the world would you allow somebody to come into lead this country that doesn't care about human beings? And then I just have to say, listen, I'm not doubting you, God. I don't understand it. I'll never understand it, but I know it's part of the end of the times. And I also know that it's part of the end of the times. We, as believers, are supposed to be positioning ourselves where we are reaching the lost, or even if they're born again, helping people to get back in right alignment with God and God's purposes for their life. And so I see this as just what I do now, particularly as I'm understanding trauma and wanting to work with people who really help people get healed, is that I know God's positioning them. God's positioning these people so they can get their focus back to what we are supposed to be doing now, which is winning people to Christ, getting them healed, laying on of hands, getting them delivered. And all that may sound like spooky to some people, but no, read Mark 16. Jesus was real clear before he left. He told him, he said, I gotta go. I can't stay here. I can only deal with one person at a time. But you all are ready to do the work of the kingdom. And so I just feel like I'm part of getting people prepared to both get saved themselves, but also do kingdom work so we can get more people in before this is over with, which I believe is not too long from now. So I'm really grateful to be part of that, and to be able to recognize some things in people and help them to acknowledge them so they can get whole. Yeah.
I love that. You
Mhm.
have some comments here.
Mhm.
I want to acknowledge Miss Francine says, "Hey, my favorite doc." Um, Miss Freeman says, "Hey, Dr. Stanley," and
Hey.
Cheryl Davis says, "Hello, Dr. Stanley," and yep, and Miss Cheryl Davis says, "What a rich legacy, Dr. Stanley."
Thank you. Yeah, I thank God every day for it. Yeah.
Okay, so transitioning into another question. What are the three most common physical complaints you see that, upon deeper conversation, turn out to be primarily driven by anxiety, stress, or depression?
Mhm. The complaints, you're asking me for three common complaints that I see. Um, I would say, oh man, okay, let me, fatigue, just kind of like this unexplained. I go to bed tired, I wake up tired.
Mhm.
Um, Anxiety, just always feeling kind of edgy or anxious. Um, and then, let's see, difficulty sleeping. And when you think about all three of those, I mean, if we don't get adequate sleep, if we're edgy all the time, then and tired all the time, it's a big part of your life.
Mhm.
If you're a mother, it affects your ability to do what you need to do with your children. If you're an employee, and I see women who are at the high level of their employment. They're up here, and they know they've got to be sharp. There's always somebody waiting to take their position,
Mhm.
um, or just people who they think I've made it, so to speak. I've achieved this, but I still am like something, and that really makes people feel crazy. It's like there's nothing else I feel like I have to do before, but they just know they are just out of sorts, and every day it takes a lot of effort, and they just don't feel good. And when you take that into a relationship, in a marriage, then you have I say, the complication of, taking your own stuff in with your spouse, and the spouse is like, what is going on? So that takes them to another level of stress. But yeah, I would say those three are probably the most common, and they're real general. That those three can be related to a number of things. But with functional medicine, I'm always able to measure and see some reasons, and two or three things usually, that need to be supported, and easily. And once they're supported, people just kind of, but then still, I want to know, is there anything else that I just ask more direct questions, to get answers that would make me think that there's still something nagging, something not quite right. And then I just ask them the hard question. And I don't believe anybody's lied to me. It just really opens the door when I ask them about traumas. And,
That's really good.
yeah.
That's really good. Like, so in your patients that have ADHD or ADD, what are some medical things that you're seeing with them, whether that's male or female?
Hmm. Yeah. And again, even when people come to me with these diagnoses, I know that some of the same symptoms that they're having, I mean, and I don't mean to simplify it, but I can check their thyroid, and sometimes thyroid nodules and too much thyroid hormone being produced, relatively common. And that can make people, where they can't focus, they're just all over the place, they're not doing well at school, they're not doing well. And so they get a diagnosis of ADHD, and I don't downplay that. I say, let's see if there's something else that perhaps if we find it, we can support it,
Mm.
um, and the symptoms get better. Because my primary goal is to find something that we can address it, see how your symptoms have improved or not.
Mhm.
And if they've improved enough, let's see then if we can back off of this medicine. Let's see if we can back off of. I don't try to take over anybody else's. I'm not trying to do that. I'm part of the team. And I tell clients, I'm part of your wellness team. So please, when you talk to your doctor about me, and I really encourage them to, but sometimes they just get such a response. It's kind of like, well, I don't know about those hormones. But I just I ask them, let them know that they've got another doctor part of their team. And so that, everybody's kind of knowing what the other person is doing. But my goal is to at least perhaps decrease the medication because I know the longer they're on it, they're likely to have side effects, and that's going to affect their life. But food is huge, Destiny. Food. And we know that. Everybody knows that intellectually. But it's amazing when you can really help people um, just be honest about what they're putting in their mouth every day. And I have a really detailed intake questionnaire that really makes them put down what they're eating every day. Are you drinking? I mean, a lot of women drink a glass of wine at bedtime. Are you drinking too much caffeine? And they've got all these fancy bottled and canned things, and so helping people to understand that sometimes it's just those little foxes that undermine your health. And then I dig deeper with them because people are walking around with food sensitivities that they don't even know they have because they don't always cause. Now,
This,
it's like milk where you get bloaty and stuff. I mean, those are, but when they do the food sensitivity testing with me and they see that, wow, eggs are not, they're good for you, but maybe not for you because your body's producing antibodies. Or even good, some vegetables. So getting a handle on what you're eating and what that's causing in your body is a big open door for improvement.
because I was talking to my allergist, and because Miss Freeman, she was with me, because I was like, my allergist refuses to give me a food sensitivity test because she said it'll be a false positive.
Well, and I've heard that. I have. And, I don't know, all I can do is share my experience. And so when people, like when you come to see me, I'll say, let's go ahead and do this IgG,
Mhm.
immunoglobulin food sensitivity. I'm not looking for allergies. I'm
Mhm.
looking for proof that when you eat this thing, we can measure an increase in IgG. So, and the I use, and I don't mind, I'm not advertising, Life Extension. LifeExtension.com is a consumer driven site where people who can't get their primaries or whatever to be on board with some of the more natural things, you can go on lifeextension.com. You can order food sensitivity testing. I get the 96 different foods. You can do that. It's just all you're going to do is stick your finger, dab blood on a card, send it into them, and you'll get this real comprehensive report. And it'll give you a good idea. And I know my allergist friends don't agree that, well, that's not really but I can only tell you what I see. So when people do the test, then they got a line all the way across the board for cow's milk, anything from cow's milk. I say, let's do this. Let's eliminate the cow's milk, anything from cow's milk for 12 weeks, and then add it back gradually. I tell you, it almost always happens. You weren't having the symptoms that you recognized before, but as soon as you eat that food,
Mhm.
try to reintroduce it, then you're like, oh my God, I had no idea. And so then you think, well, duh, I'm not going to do that. I'm not going to make myself bloated and gassy. So it empowers you really to do some things. Because when
Mhm.
you're eating foods that generate that sort of reaction, you're causing inflammation in your body. And inflammation is the number one underlying cause of every known disease, including cancer. So I just think it's important for people to know. And then you make a decision. hmm You decide. And yeah. So and the other thing I like to do is to really look at your microbiome. What bacteria do you have down there? Do you have the right ones? Do you have the right amount? I see a lot of candida yeast overgrowth on the stool analysis. And I treat it just with herbal things, just to get that load down because that'll create a lot of inflammation. So we really do have a lot of power to be well, and you just need somebody to guide you to do the right things, identify things, address them. Yeah.
Mhm.
Yeah, it's pretty powerful. And the whole weight issue, this whole thing about weight, again, we know that it is related to food choices, but it's more than that that causes increased weight. It's when you have inflammation in your body. Your body, it's gonna be hard for you to lose weight if you're inflamed. It's going to be hard for you to lose weight if your adrenal glands are overworked because you're stressed out and your cortisol. So you need to know that. So you have something to work on. And then menopause and the female hormonal things unsupported, you start getting the belly fat. So I say that to say it's not impossible to lose weight. It's just identifying those things that create less of a environment for good weight loss is important, and they're all measurable. So yeah, but that's the biggest frustrator that I hear from women. Yeah, the weight
So,
gain.
so like in the transition to another question, the medical
Mhm.
profession is notoriously high stress. Can you share a bit about your own mental health journey as a doctor, navigating the
Mhm.
pressure of
Yeah,
patient care and demanding hours?
yeah, and that stress starts in medical school. It, yeah, yeah, I can remember a point in medical school, and I was a good student. I didn't really struggle with learning, but till I got into, I think it was a biochemistry class or something. So the information was tough. This is a medical school, and the schedule, the demands. So it's not like you have all this time to learn this new stuff. There's a schedule, there's demands and pressure, and you're away from home, and you know barely got stuff to eat in your apartment. All those things that life brings. And yeah, I remember thinking, I don't want to do this. It was just I just hit a wall. And I was in St. Louis, which wasn't too far from Kansas City. But somebody talked me through it. I wasn't a believer then. I didn't know Jesus, so I didn't have that to turn to. I didn't have Him to turn to. So just there weren't a lot of blacks in my medical school, but we did have a nice circle that we could encourage each other. So yeah, I remember that. That was hard. And then residency. I don't know why they put a human being through. I know you have to learn. You have to learn right on the spot with sick people.
Mhm.
Cruel system. You'd be up for 24, 36 hours. The worst, the food out of the cafeteria. So that's stressful and not good for health and mental health. Um, and then, residency, stressful. You think, oh my God, I'm going to have to go to the hospital and make decisions, by myself. I got an MD. So yeah, lots of stress along the journey. And most people are not even, you're just doing it. That's what you wanted to do. So you just press through, press through. But now, healthcare, I'm really concerned because I think the pandemic was the wall that, that a lot of doctors hit and made a decision. I don't even want to stay in this profession. So we have lost over 100,000 physicians, and I'm not sure what time frame. That's a lot of people, and physician training is not short. 4 years of undergraduate, 4 years of medical school, at least 3 years of residency, even longer if you're going to surgery. So it's an interesting time. And that's why they're training, a lot more nurse practitioners and physician assistants. But MDs, it takes a while to, roll out. Very stressful. Not good for health. And that's kind of weird. I mean, you're going into healthcare, but you're doing things that are not good for your health to get there.
Thank you for sharing. I think thank you for sharing that. I think this is your sister, Rogers Moore says, "Hi, sister.
Hey,
So glad
Rob.
you're following in the spirit."
Uh, yeah. She was just here with me at the ribbon cutting. She lives in Atlanta. And we were at the ribbon cutting for the Rogers Health Center pediatric unit. So that was fun. Yeah.
She said, "Hi, sister. Shout out to sis. Made it back to Atlanta safely." Miss
Mhm.
Francine said that she will be in your office in the beginning of 2026.
Okay, I'll be looking. I sure will. I know you will, Francine. Thank you.
So, are
Mhm.
you open to any, like, do you have a cutoff on how many clients you have, or people could just, if they want to contact you, they can?
Yeah, and here's the thing. I don't have a cutoff, but the cutoff is I don't want to say that it's a mindset. So let me explain. When I decided to go functional medicine, insurance companies are like, "What? What is that?" And so they don't pay for functional medicine. The insurance companies that I was with for 20 years doing primary care, they don't recognize it, so they didn't want to pay for it. So I had to make a decision. So yeah, about 18 years ago, I came out of the insurance network world because they just weren't paying. So functional medicine is most places is a fee for service, meaning you pay out of or out of pocket is a better term really, and that's hard, Destiny, for people, all of us. I mean, we were raised that when we get a good job, we're going to have health insurance. It's going to pay for our health care.
Mhm.
So it's hard sometimes for people to think, you mean I got to pay out of pocket for my health care? Because they don't, in the beginning, really understand functional medicine. But generally, what people will do is they'll just say, I'm going to make this investment out of my pocket or with your HSA or FSA or Care credit card. So I say all that to say that that limits, the number of people who just come. Because if I was still being paid by insurance, oh boy, I probably would have had to I'd probably have to really limit some things because everybody would be trying to come. But
Mhm.
but I still encourage people. I said, think about what we spend our money for. Lots of money on hair, lots of money on makeup, lots of money on clothes. So we just have to make up our mind that we're going to shift,
Mhm.
invest. And so when people first come to see me, I make sure they know it says out of pocket cost, and I'll share it. I'm not embarrassed to share it, if you want me to. But so you'll come to see me. Now, your lab is still covered by your insurance, and that's the most expensive part of it many times. So I
Mhm.
give you a lab order form, and you go into where your insurance requires LabCorp, Quest, get your lab done. Insurance pays for it. I make sure I have the right codes on there, so that's not out of pocket. But the actual, and my first consultation is 90 minutes, where we cover and you leave there knowing one, two, three, what it is I saw on the lab based on your symptoms and so on. Here's what we're going to do about it. I'll call it, so it's a real, we go over nutrition. It's very detailed. It takes 90 minutes. Yeah. So, yeah. So,
Okay.
so I tell
You
people, mhm.
still reach out to her, y'all. Y'all never know. You
I'm,
never know.
I'm telling you, and it is the best thing that you could ever do for yourself. I'm telling you, because you're not know these things otherwise. You're not going to know what are. You're not going to know if right now it already looks like you're heading to diabetes. Diabetes to full blast show up takes 6, 7, 8 years. It doesn't happen overnight. And when we're measuring your hemoglobin A1C way down here, and we see that thing is already 5.6, 5.7, oh no. So we can let you know and say, okay, you got to change your diet now so that we don't get out here and they say, oh, your blood sugar is 500. That doesn't happen overnight. There's an interval in our lives where if we knew some things, we would have time enough to make the adjustments and changes and prevent a full-blown diagnosis. It's powerful. So you can do this. I mean, you can, yeah, just reach out to me. Reach out to me through the website, or you all know me. It sounds like a lot of my church sisters are on here. You know how to reach me, and I'll get that email to you with the lab order form and all the details of cost and so on.
You know your Harvest Church crew is deep in these in these chats.
Yeah,
They
yeah.
are.
Um,
Okay, so next question I have for you is, what are the most common mental health diagnoses you screen for in your functional medicine care, and what red flags often surprise patients when they realize the connection between their mind and body?
between what was the last part?
Between their mind and their body.
Oh, okay. Um, and I, the first part of your question, I don't necessarily probably do as, and that's a good point, do as thorough of a screening per se. I just know that in the context of there's 2 pages of the health questionnaire that you fill out in the beginning that are system, cardiac, GI, neurologic, just a list of different symptoms that people check off in every organ system. And so it's pretty easy for me to see in that central nervous system, neurologic, psychologic piece. I can easily see symptoms that could be aligned with a lot of mental health diagnoses. So I can't say I can make a diagnosis, but I see those symptoms that, we need to pay some attention. But here's the thing, a lot of those symptoms are also related to what we call poor metabolic health, blood sugar problems, hormone. And those adrenal glands, we got 2 of them, they work on our behalf all the time. And so they're like anything else, they run out of gas. And when your adrenal gland health is not good, the symptoms are like somebody who's got depression, ADHD. I mean, you can put a lot, I can label them, except that's not really what I'm trying to do. And it's so much overlap between diagnosis and their symptoms and what we ultimately measure. So, I can't say I focus on mental health, but it just shows up. And there's a question about, have you ever had significant trauma in your life? Have you had any therapy before? And those 2 questions are really open the door, really make me be more attentive to some things. And then just the medications they come to me on, I think, somebody thought they had this. And then I'm just determined to find other things, measurable, changeable, that will help more than the medicine, or at least help enough where there's some hope that you can be on the lowest dose of medicine and still have the effect. So I'm not an anti-medicine person. I just know that many things that we medicate are really can be supported with, nutrition, hormones. And I'll say this to the ladies, because you all know I love hormone stuff, and I'm still writing, Lord knows, trying to write books. And so from the young age of 13 all the way up to when we're in our 60s and 70s, we understand what's going on in our bodies, so we're not taken off balance. We know it's going to happen. That physiology is going to happen. We cannot change that, but we can plan for it. And as we're heading, young women in your 30s, perimenopause is starting.
Wow.
So let me tell you, your estrogen and progesterone are just very slowly. And young women, increasingly, I'm seeing 35, 40-year-old women, early 40s, they just think they're crazy. They think they're losing their mind. They're anxious, and these are people who, they don't have any mental health diagnosis, but just like all of a sudden, and it's because they're slowly losing. Progesterone is like a medication in the sense that it works in the GABA, on the GABA receptors in our brain. So you're talking about just, I use progesterone a lot, even in younger perimenopausal women. So yeah, it's just time to tie things together, and that's what I believe I bring, is to make sure those other things are right, and if they're not, I support it. And if the symptoms continue, we know I need help. I'm quick to refer. because I'm not a mental health specialist. Yeah.
That's good.
Yes,
Mhm.
ma'am.
You have a comment here from uh Ms. Cheryl Davis that said, "I concur. Your services are worth the cost."
No,
Um,
I'm sorry. She said what?
she said that I'm sorry. I believe Tony Stanley. That's
That's
your
my
husband.
sweetie. Hi, honey.
Okay,
That's
I'm gonna read Ms. Cheryl Davis' comment first. She said,
okay.
"I concur. Your services are worth the cost." And then Mr. Stanley says, "Doc, do you treat men?"
Oh yeah, yeah. I love working with. All right, Pastor Stanley, I'm gonna get you. Yeah, I just in the last, I'd say few years, with all the pandemic and you start doing a lot of virtual, I do a virtual practice with men. And men are, we know how men are. It's like they finally tell you something's wrong because they stay quiet for a long time. They stay miserable for a long time before they reach out. So when they finally reach out and get that testosterone level checked, and I say, this, look, this is what I'm saying. Here's what we need to do. Men are like, tell me what to do. Boom, boom, boom. And then they're like, and they don't drag their feet. They just follow the directions and they get the results. And these are 30 something men. So if you've got a man in your sphere, doesn't have to be your husband, but even brothers or 30-year-old men I'm seeing with testosterone levels in the 100s and 200s, and it should be 800, 900. And again, it's a stress factor. It's the toxins and these men are trying to function at a high level in their 30s, trying to go up the whatever, and they're tired. That's the number one symptom I see in men. Not erectile dysfunction, fatigue, no energy. Every last person that comes on this platform that I see, that's their first symptom. And then down the road, it may be something sexual, but it's affecting their quality of life day to day. But when they get the answer and get treated, so yeah, don't forget about your men and brothers, well, whoever. If you start seeing some changes, they're just laying around, they're not motivated, they're not exercising, they're getting bellies. That's not a good sign metabolically. They need to have some lab work done and support it. There's no shame in it. And if you're married, there's a something called couple pause. Listen, we go through pauses together. Men have andropause, women have menopause. Hormones are lowering, libido's lowering. Somebody's not happy in the marriage because the wife is like, leave me alone. The husband's still trying to do something, but it's supportable. I'd say fixable, supportable, and it's a beautiful thing. So yes, sir, I do see men, and I enjoy working with men.
You have quite a bit of questions in here.
Oh,
Thank you for answering that question. It says, Dr. Stanley from Miss Francine. She says, "What about all these children coming under autism within our community?"
mhm. And that's I don't believe we know the full answer, but it's clear that there's probably more than one thing that has seems like suddenly changed where all these children are getting this diagnosis. And so I don't know the answer to it, but I think it's probably a combination of environmental. And again, you got to think about the mothers. What's happening to the mothers when they get pregnant? You have to think about that part of it, the whole prenatal piece. But then, what is it that's affecting the brains of children along the way, developmentally? And I'm not on that age side of taking care of people, but I think it's probably a combination: nutritional, environmental exposures. Um, I don't know, but it's kind of scary to watch. But I really encourage parents of autistic children and it's not easy, manage that diet. That I've seen make the most difference many times, and just make sure that you're because I know that children can be difficult to eat unless you give them exactly what they want, which tends to be not good, particularly in autism. But yeah, it's not one thing. Yeah.
Hmm. Your next question comes from your sister. She says, "Functional medicine in time with Dr. Well, not question. She says functional medicine in time with Dr. Rita will educate you and open the door to your wellness. It is essential and well worth it.
Mm, thank
Ms.
you.
Cheryl Davis says, what functional services do you have for your seniors who have gone through menopause, who want to feel spunky?
Mhm. Yeah, and here's the thing, that whole term going, I've been through menopause, and I just tell you, no, you are still in menopause. So that term makes it sound like, whew, just let me live 5 more years and I'm through it. No, menopause is the last third of our reproductive life. So we die in menopause. Now, the confusion that you hear is some people will say, well, you don't want to give women hormones after a certain age, after 62. So that has meant that many women have been taken off of their hormones at an age. It's kind of arbitrary because of concern about hormone use, but you never go through it. We stay in it. And here's what's becoming clear in the science and studies is that women's brains change when that estrogen level is depleted. And they've done serial brain scans and seen the changes are consistent with dementia and they see the change, they see the improvement when women are supported with hormones. So I think now personally, I don't intend to ever come off of it. That's my person. Now I do have the conversation with women older. If you're 65, 68, I have the conversation. If they already have a lot of cardiovascular disease, there may be a reason to decrease the dose of certain things, but I want to live until I'm out of here. I want to be. People say, "When are you going to retire?" And I think, what would I do? Now I'm changing some things. I have an office in my home now. Things that make it easier for me to continue without the overhead of all that kind of thing. But I want women to be able to think clear till they take their last breath. To just feel energetic and in control of their thoughts and so on. So in my practice, I don't consider there an endpoint for hormones for women. I take it person by person, look at their other health history, and then make a recommendation to them. Even if it's just progesterone, if I just keep them on progesterone. Because estrogen is the one that causes the worst kind of concern, if there's going to be a concern. But progesterone, yeah.
Well, I have a question that I didn't write down that no one else asked.
Okay.
So I am in my early 30s, but I've not had children. Should I be worried about putting off having children? Well, I'm a wife and I'm a wife in waiting, so I waited with my husband. But should I be worried about being pregnant closer to 40?
Yeah, and no, I worry. What you should just understand is, we are born with all the eggs we're ever going to have. So we're not producing new eggs, women. We're born with 400, 500,000 eggs waiting to come to every month to become mature after we have our first period. So here's what happens. They die off. As every year we get older, you lose some of those eggs. So the longer we wait, 40s, early 40s, your egg supply has reduced, just natural attrition of the eggs. So that, of course, can mean, you know, your likelihood of getting pregnant. And we know that it's decreased as you get older, 40, early 40s. So, but there are some women, who still get pregnant at 49 and 50, but you're high risk at that time. So you don't want to wait that long. So here's what I tell women. I say, listen, just know that, that you're not going to get any new eggs. So take care of the ones that you have, which basically means take care of your body. And so now's the time for you to just start paying attention to those things that a lot of times we just don't even want to know. Don't tell me because I want to eat what I want to eat, sort of thing. But right now, you should be thinking, how can I eat well for my general health, just for general health, cardiovascular health, brain health, all of it. How can I eat And most of us know how to do that, but just really taking the steps to plan and engage somebody to help you. I mean, there are people who will help you just really lay out your plate and understand these different, what you should be eating, um, so that when you get pregnant, your body, you're not carrying a lot of extra weight, you're not inflamed. I mean, things are functioning better. And then, I mean, you just have a good, healthy pregnancy. But I don't want women to be. Let me tell you what I'm afraid about with women is the way that birth control pills are just like handed out. And again, that's a way of training. We traditionally trained doctors use birth control pills for, of course, contraception. They also use it for acne. They also use it for PMSS, so it's kind of like this here, take these pills. And for the most part, the birth control pill will work in those different situations. But you have to say, why does it work so well? How does birth control pill work? How do they work? They shut down the normal signal from brain to ovaries to produce an egg. So it's a shutdown system. And so a lot of women love that. Oh God, I haven't had a period but you're paying a price for that. You really are. And they'll tell you, oh no, as soon as you stop these pills in a few months, you'll be, So I just ask women, I say, listen, if you have a choice about contraception, try to get a non-hormonal contraceptive. IUDs that don't have hormones in it. Copper IUD doesn't have any hormones. It's effective. So try to find things, barrier things, and not quite as convenient, but not exposing your body to these hormones. It just kind of shut down the normal system. So that's what young women really have to be careful and stay healthy, get in your healthiest. And then when you're ready, yeah. Oh, and then let me make this final statement. And when you find that Boaz finds you, you all have these conversations about what is it going to look like, how many children do we want. He needs to be engaged in, at some point, sir, are you willing to have a vasectomy? That's a conversation that needs to be had, because what that does is it removes the onus of the woman to otherwise we'll be contracepting till 50. That's a long time to have some hormone, and these are not natural hormones in contraceptives. So we bear that burden unless our husbands step up and say, okay, when we've had enough children, then I'll take the step so you don't have to be exposed to hormones. How about that?
Right. 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 I have a few more questions with you, and then we will wrap up.
Okay.
Is that okay? All right. I'm gonna get her back to you, Pastor Stanley.
He's eating. He's good.
Okay. So, what non-pharmaceutical interventions like nutrition, movement, or mindfulness do you integrate most successfully into your functional care practice?
A couple. Nutrition is at the top of the list. It just is. It will always be that, and that's a whole nother conversation. The other is, well, maybe this go. Sleep. You will have to understand the importance of sleep. The timing of your sleep, trying to be sleep by 10. Because remember, you got a clock in your body. God did a thing. He puts this circadian clock, is what it's called. And that clock is establishing what you should be doing at certain times because, hey, the clock is going to do what the clock's going to do. It's going to start producing melatonin by about 7. Why? So you can relax and do the sleep by 10. And then when you're asleep at 10 and get into that deep realm, oh, the magic occurs. Between 10 and midnight, you got things, hormones that are being produced that'll help you keep your weight down, that will help you keep your appetite under control. But if you're up, and I'm guilty, up with the phone, it's midnight, and you're watching the latest, whatever. So getting sleep at the appropriate time, 7 to 8 hours, important. Nutrition, oh my God, so important. And we know the exercise piece of it too. But let me tell you what else is important, particularly now that we are living in a world that's just crazy, crazy. That is prayer and meditation. Now, and I'm not talking about, shutting down your mind, empty your mind, close your eyes, hum. I'm not talking about that meditation. Meditation is a biblical principle. Meditation, if you look in the Bible, there's a word called Hagah. Study Hagah. Hagah. And it means it's the biblical form of meditation where it's kind of loud. You're muttering the word. It's a Joshua 1:8. Joshua 1:8. Remember what Joshua said? Meditate on this word day and night. And he's talking about the kind of meditation where you are muttering the word, you're speaking the word, it's a very active thing that keeps the word of God before you. And they've done studies that show that brain waves, the things that they see in stress kind of quiet down when we meditate and pray. So just include, because we all pray. I think most of us probably have a good habit of prayer, but in the midst of that prayer, don't stay quiet. Speak the word, say it out loud. And we know that also helps build our faith. So nutrition, sleep, and meditation are biggies. Oh boy. Yeah. Your life will be different. Your body is going to respond to that. It's going to be doing all kinds of things at the cellular level that you can't see. Mm-hmm.
Okay. I like that. It got me to thinking.
Mm-hmm. Yes, get that word out.
You having that relationship with God and you just talking about this fellowship. Yes.
Yeah, that's right.
So
Mm-hmm.
next to last question. What is one thing about the future of medicine that gives you the most hope for better mental health integration?
I believe that because of the toll that time and the pandemic and a lot of disruptions to healthcare, I believe that now the minds of a lot of people are open. Educators, people who want to go into healthcare but not like the traditional, and we always need tradition. But I think it's a combination of what's happening in our world that now I see all manner of training opportunities for functional medicine. Just people who are just not in the formal education of healthcare providers, but just in their own way. So you see these segments of people who are being certified. And there's some cons to that too, because I mean, you can't just take a weekend course and then think you're going to prescribe hormones and really have the experience. You can't rush experience, but at least the mindset is open and there's more available to people who are interested in doing something different or just in addition to the traditional medicine. And I really, to me, if I were younger and just building, I would have at least a couple of therapists right in my space, because to me, you're missing a big part of it if you're just focusing on the physical measurement of things, because you can't separate that mind, that mind piece of it. It's got to be partnered with the other, because again, we're triune. The spiritual side is the spiritual side, and we need to hone in on that. But when you start talking about the soul, Jesus, and the body just follows. So that soul, which is your mind, your will, your emotions, that's where you're talking about. The mind, the will, the emotions, the imagination is your soulish realm. And I can tell you, when we get to the point where our spiritual side and the soul are lined up, then the body just, okay, it just kind of lines up. Okay, it can't do anything else. So just having the whole, you can't separate it. That's what yeah. So I think we're moving in the right direction. We'll have to be careful, because again, some people just want to make money and they're going into functional and they're doing a lot of hormone stuff and putting in pellets. So, I just try my best to, because increasingly people ask me, can you come and can you be our medical director at this wellness place and to help train the people to do this? And I can't do all that I'm asked to do, but I do at least bend the owner's ear and say, don't rush into this because you cannot rush experience. And so you don't want to hurt people in the process of trying to help them and make a lot of money. But yeah, I think it's an exciting time. Yeah.
That's really good. Wow. Last question.
Okay.
Finally, how do you care for yourself mentally when you have to deliver difficult news or when you know a client's situation is beyond your capacity to fix?
Mm-hmm. To be honest with you, sometimes that's easier. When I say that, I don't really see that aspect of care in my practice anymore, where people are getting worse and terminal, or there's not a lot anybody can do for them. I just don't see that anymore. But what I am involved in is in the lives of people that I know and love and go to church with, who are either in that, that. Um, and I tell you, sometimes, I don't say it's easier, but when you get to the point where, only God can do this. Only God can do it. Sometimes it's easier to minister from that perspective, encourage, just make sure they are not forgetting the word of God. What does the word of God say? We're not talking about denial, but what does the word of God say? What did he say about this? And then just making sure, I increasingly find myself just taking authority over some things that are either generational or things that are keeping people in this mindset that, I'm going to die, and we take authority over that spirit of infirmity that always wants to grip you. We take authority, we command it to go now and get them in agreement. And once people can do that, um, so yeah, I mean, I use everything I have to my advantage for people. And like I said, in my practice, I don't really deal with terminal things, but certainly in my personal and just people who reach out, and just, get myself and Pastor Stanley involved in their situation. Honey, it's all about reminding them who God is, what he has already done, that stripe, one of those stripes on his back was your cancer. And by his stripes, you are healed now. And, just provide them, sometimes just provide them with scriptures to say, to proclaim, to declare, to decree. To me, that's part of, I'd love to see the whole healthcare system be able to do that. That'd be powerful. But they go out of business, really, sincerely. But, more people who can do that on behalf of people.
You get a doctor, you get a functional medicine physician, you get a prayer warrior. Come on now.
Right. Listen, you got right.
And that first lady, because she ain't mentioned that, but there's a first lady, Dr. Rita Stanley.
Yeah, she spanks sometimes, Destiny. I just have to get my belt out sometimes. As the first lady. But yeah.
I know Miss Ruby was telling me, she was like, she was telling me, I told her something. She was like, do I have to write a letter? You told her, do I have to write a letter, let them know that you need to take this dress? And I started cracking up. We was cracking up about that the other day. Literally.
Yes, ma'am.
Okay, so before we wrap up, is there anything that we did not address that you would like to share, or anything that you would like to ask me?
Yeah, so what direction are you going? Are you interested in health, wellness?
Ooh, so
mainly as an information provider to people. Maybe that's, I'm reading too much.
So I'm getting my Master of Science in Cyber Psychology, which is cybersecurity from a psychological perspective, which is online behavior. Identifying people and why they do what they do, hackers, social media bullies, whatever that may be. But I've always been interested in the neurological, and it's like for me, I've been working on this invention, to be able to really help people understand trauma from a total different perspective, but also like the stimuli that trauma is being, placed in. So I've been running away from it because of, I'm scared, or I don't know if I'm smart enough for that, but
Mhm.
just know that I am aiming for that PhD.
Mhm.
So
Do you ever read or listen to Caroline Leaf? Leaf. Oh, you got it, Dr. Caroline Leaf. She's a Christian woman, but she's been in the whole neuroscience forever, and she will. You'll be eating that stuff up, Destiny, because she explains the parts of the brain that operate to help you. Just go on YouTube. You'll find a quadrillion videos, but she's got books. It'll just change your whole perspective on the mind. She's a scientist, but she ties that into the Word of God, and you're like, okay, and it just helps you to, yeah.
that stuff interests me. Like I've been for my whole entire life as a trauma survivor, tumultuous trauma survivor, have been trying. I always say I try my trauma by my healing and my healing by my trauma. I've been seeing that the exposure to different things that were not, exposed to me on a positive level have been able to balance, chemical imbalances, whether that is, anything medically that may be happening as well. And I've been using that in documenting my research for my invention, because I'm seeing a huge turnaround in how my cravings for food, people, environments, and just like the exposure, even my sleeping or whatever that may be. So
Yeah, you're doing the work. But keep pressing in, I'm telling you, because, boy, more and more people need to have people like yourself and like myself, who we know the science part of it, but we also understand the God side of it as well. Yeah, yeah.
yes, ma'am. I mean, because if you know any internship opportunities, working alongside a neuroscientist, neuropsychology, whatever that is, I am open for that. You don't even have to be paid. I'm just really like,
You
that
want
stuff
to
excites me.
Yeah. Well, listen, if I do come across somebody like that, I will definitely let you know. Yeah,
Awesome. Awesome.
that would be
Miss
great experience.
Miss Freeman says to tell you, you are wise. You are a true gift to us all, and especially women.
Oh, thank you so much. Thank you, Miss Rashana.
Okay, so that is concluding all of my questions. I'm gonna read my outro. Um, you can exit if you like to. I'm just gonna play my music and do my outro. But thank you so much for
You are
being.
so welcome. Thanks for
I'm,
having me.
I'm kind of thinking. I'm like, I don't know, everybody. Should we try to see if she could do a segment every month? I
Oh,
mean,
hey. See what they want to hear. I'll be happy to help.
okay, all right. We see about getting it in the works.
All right. Thanks, Destiny.
Thank you,
Bye-bye.
Dr. Stanley. Bye. All right, everybody. That was an incredibly vital conversation bridging the gap between mind and body care. My sincere thanks to the insightful Dr. Rita Stanley for guiding us beyond the physical, addressing mental wellness in primary care. Her perspective proves that true health is holistic. If Dr. Stanley's insights resonated with you and changed how you view your own health, please help us amplify this message. Head over to YouTube, find Persperity Podcast. That's Persperity Podcast. Hit that like button and make sure you subscribe and click that bell so you'll never miss an episode. Please also share this conversation with someone who needs to hear it. Thank you for listening. And just know we'll be back next week with another amazing guest. And always remember, mindful moments equal prosperous lives. Goodbye, everybody. See you next week. Sorry, I always go into this whole entire this thing.